Men in particular are at increased risks of mental health problems and death due to suicide or alcohol use during times of economic adversity. With the current economic situation, how are men coping? What do they do to maintain their mental health? Here are the views of Abuja residents.
To be honest, we're barely coping. We're just surviving. There were times, we've had better times. It seems to be going down the hill these days. We've had to cut down a lot of luxury. We are just managing. We just eat and flow. It's not supposed to be that way. We're struggling. We're not coping. I'm not coping. And I'm sure I speak for majority of the Nigerians when I say we are not coping, we are struggling, we are surviving.
We men, uneasy lies the head that wears the crown. So many things, some men, school fees, housing, house rent, and some other things like that. It's not easy. Even to feed in the house these days, it's even difficult. To pay the school fees of our children is also very difficult. To pay for our house rent is serious. So what we are begging is for government to continue putting necessary machinery in motion to make sure that they cushion up the effects of this economic hardship. Actually, Nigerians are suffering. It's not easy. People are crying. Traders, civil servants, any sector of the economy, people are crying. They are begging government to come straight and help us out of the situation.
Some people cannot have the square meal a day. The square meal a day, they cannot take it. Things are becoming very worst.
Okay, because the situation of the country, the economic situation of the country is too bad. Honestly, because men, what we are using 1,000 naira to buy is what I use 15,000 naira to buy. So the men cannot cope with it because they are the head of the family. They want to support the family. That's why I see many men now. You see them as if they are suffering from typhoid fever. They have lean.
There is evidence that debts, financial difficulties, and housing payment problems lead to mental health problems, but in nations with greater social safety nets, the health impacts of the economic downturn may be less pronounced.